A 58-year-old man is reviewed in a clinic following the successful cadaveric renal transplant in the previous year. He has been able to return work as a swimmer instructor. Over the past week, he report that he has been suffering from a recurrent episode of the diarrhea. It has made him feel lethargic and exhausted. Stool microscopy shows evidence of the cyst. What is the most likely source of the infection? So we have to find out the cause of the infection in a patient who is the renal transplanted patient and now present with a recurrent episode of the diarrhea. That means it is the solely pathology of the gastrointestinal tract. So what may be the answer? Here the options are Enterobius vermicularis, Colonorchis sinensis, Giardia, Ascaris lumbricoides and Cryptosporidium. So what may be the answer? First of all, the Cryptosporidium. It is an protozoal infection. So Cryptosporidium, it is usually caused by the protozoa, and the organism produces cyst. The organism, that means the Cryptosporidium, it produces cyst which is excreted in the stool and it causes the new infections. So the Cryptosporidium, it produces cyst and this cyst is responsible for the new infection. And what are the symptoms? The symptoms, it includes the diarrhea and cramping abdominal pain, and it is solely in the gastrointestinal pathology. That means the Cryptosporidium, it is gastrointestinal pathology. It usually occurs in case of the immunocompromised patients. So in this condition, the diarrhea and abdominal pain, it is highly suggestive for Cryptosporidium as the patient is immunocompromised, and the symptoms are worsened in case of the immunocompromised or immunosuppressed patient. Cyst may be identified in the stool and treatment usually by the metronidazole. Cryptosporidium, it is usually associated with infection and it usually associated with the immunocompromised patient. Here we can see this is the immunocompromised patient. Diarrhea is the main disease. That means diarrhea is the first symptom for the Cryptosporidium, and in case of the stool microscopy we found there is the cyst. So what is our answer? Our answer is the Cryptosporidium because it occurs in case of the renal transplanted patient. That means renal transplanted, that means this patient is immunocompromised and it present with the episode of the diarrhea. That means it is solely gastrointestinal pathology. Other options here such as the Ascaris lumbricoides, Enterobius vermicularis, Colonorchis sinensis, usually they not occurs in case of the immunocompromised patient. They occurs in normal individual. And also here we can see the Giardia. In case of the Giardia, the cyst and also the other form also present in case of the Giardia, but in case of the Cryptosporidium only cyst present in the stool microscopy. Thank you.